And let's move on now to other news that we are breaking. India is on COVID-19 alert. There's been a nationwide upward trend that has sent alarm bells ringing. A sudden spike in COVID cases in the past few days, especially yesterday. Union Health Minister Dr. Mansukh Mandaviya will be chairing a review meet with the health ministers of all states and union territories today at 11 a.m. According to sources, this was a review meeting to know the COVID situation and preparedness in the country. The Indian SARS-CoV-2 Genomics Consortium, INSACOG, will also attend the meeting. Harsha, my colleague, joining me on this story. Harsha, what do our viewers need to know at this point? Tell us about the numbers. Tell us about, the kind of precautions that urgently everybody needs to take. What is the urgency even as we speak? Because the cases have suddenly spiked.
Exactly, Rukma. Now it becomes very much important because if we compare with the last year, 2022, we see that this year there is a 27% spike in the COVID cases. Right now, the COVID cases are more than 5,000 in the entire country, which has been reported in the last 24 hours. If we talk about national capital, there are 600 cases, and death has also been reported because of COVID in national capital. And in total, there has been 4 deaths in the country in the span of 1.5 months. So it becomes very serious because this is the sub-variant of Omicron. This is XBB 1.16 variant, which is the mutation is very much higher, because of which the patients have the symptoms of the flu-like symptoms, the COVID-like symptoms. But yes, the minister says that hospitalization is very less in this mutation, but still we need to take precautions. The preparedness have to be checked. The hospitalizations have to be made better for the patients who are arriving and getting admitted with a COVID-like symptom. Therefore, a review meeting by Health Minister Mansukh Mandaviya is being done today. Few days ago, we saw that Prime Minister Narendra Modi chaired a COVID review meeting, and today, in context, just as a follow-up meeting, Health Minister Mansukh Mandaviya will have a meeting via video conferencing with all the health ministers of the state at around 11 a.m., where he will review the preparedness, the hospitalization, what's the current status in each and every state in our country, be it Kerala, be it Maharashtra, be it Karnataka, be it Tamil Nadu, be it Odisha and Uttar Pradesh and Uttarakhand, from where we are seeing very high number of COVID cases. And these are the states where actually attention needs to be put into. So the preparedness, the hospital facilities, are they available, the oxygen concentrators, the manpower, the requirement of doctors and educated facilities, are they available in the hospitals or not? That's the main focus of today's meeting, and therefore Health Minister will be there, Health Secretary will be there, the people from INSACOG and NTAGI will also join this meeting. The meeting will start at 11 a.m. and all eyes are on if any new guidelines will be given to the state or not, if the mask will be made mandatory or not. Because right now, what the release or the circular notification we have seen from Health Ministry, they have given the preparedness and to be extra alert and cautious and to take precaution. But till now, mask mandation has not been told in the notification. So this meeting will tell us more broadly that where mask is to be made mandatory for the states where the cases are spiked and are rising more than 8% on a daily basis. So that will be the agenda of the meeting. Rukma today. Back to you, Rukma.
Right, Harsha. Many thanks. All eyes on that 11 a.m. meeting. Many thanks, Harsha, once again.